And joining me now is the response coordinator for the White House Coronavirus Task Force, Dr. Deborah Birx. Dr. Birx, welcome back to Meet the Press. And let me start with the issue of reopening. And that is the 4 states right now that are doing some phase of it. None of these 4 states are meeting the guidelines that you laid out about 10 days ago of what these phased reopenings would look like, what metrics each state should be looking for before they begin this. This wasn't a mandate. They were guidelines. I grant you that. How concerned are you that we are up to 4 states not following these federal guidelines?
We put out the gating criteria to be very clear about what epidemiologic pieces we thought were critical, what healthcare delivery pieces we thought were critical, and what surveillance and monitoring pieces were critical. And we still believe strongly that those are the best public health recommendations to every state and every governor to follow.
Would you advise any one of these states that have reopened right now, Georgia, South Carolina, Alaska, Oklahoma, to be reopening right now?
Well, each state is different, and the reason we made the guidelines and gating criteria very specific was also, and I'm sure a lot of people have missed the asterisk, and it said to look not only statewide but also county by county. And I've been very struck by how different the outbreaks are from the metro regions to the rural regions to the county regions. And that's why we look at things in a very granular way, and governors should be doing the same, because there are areas of every state that are much more stable and much more spared this epidemic than other areas of states.
Are you concerned, though, that if you have already 4 states not following the guidelines that you laid out, more states appear to be ready to possibly do that as well, that we end up losing all the ground that we've gained over the last 6 weeks?
I've had really very good conversations with a series of governors, and they've really been very insightful of how they're looking at this. They understand the risk, and they talk about this not as turning on a light switch, but slowly turning up the dimmer, very slowly. And each that's why these are in phases, and each phase carries a very specific piece. And to all the American people, please read those phases, because it was very clear that if you have pre-existing conditions, or you're the elderly with pre-existing conditions and have risk factors, we strongly recommended that you continue to shelter in place and continue to be protected and continue to follow all the guidelines. And anybody that you interact with, ensure that they're also following the guidelines very carefully.
Well, now that actually gets me to my next topic with you, and that is the issue of testing. I'd actually, instead of me asking the question, I'd like to get you to respond to Bill Gates. Here's what he said to a colleague of mine yesterday on the testing issue.
Of all the things I'm most surprised about the federal government response, the unwillingness to get involved in test prioritization is the most amazing. We have 330 million people, and our testing capacity is under 200,000 a day.
Dr. Birx, I know you have had your own, you've worked with the Gates Foundation in the past, so I should set that aside there a second. How would you respond to him?
I think he's very clearly, there's a piece of us that have worked together to do 2 things. And I think what's really important is for the American public to understand how we're doing these tests right now. Uniquely, we're using nucleic acid testing. What does that mean? You're actually sampling for the live virus in people's nose or in people's throats. And then you have to expand that doing what we call nucleic acid testing. So this is not like a flu test or a strep test. So when we talked to the commercial companies almost 8 weeks ago, we asked every single corporation and every single diagnostic company that had nucleic acid testing capacity on their platforms, which is primarily HIV and HPV, and makes tests for those platforms. And in less than 2 to 3 weeks, every single one of these platforms are up and running. Now, what we did with the states, and I think what Mr. Gates points out very clearly is what did we do with the states to ensure that we've identified all those platforms? And over a week ago, we sent out to states every single platform where it was located, over 5,000 platforms across the states, and showing geographically and by zip code where they're located. That's allowing us to work closely with the states to unlock that full potential and to prioritize first states that have had outbreaks, but also states that need to do active surveillance, what we talked about, asymptomatic surveillance, to really find cases before people have symptoms. And that's what we're doing right now with every single state.
Look, the debate about testing, and I know the president gets defensive and claims that testing has been a success story. What it does feel as if there's a hesitance to use the Defense Production Act in order, whether it's swabs, whether it's getting these reagents, whether it's forcing these labs to process things faster, guaranteeing some funding for it. Why the hesitance inside that task force?
I think all of those pieces are discussed with inside the task force, from generation of swabs to generation of tubes and the media. I think what people don't see behind the scenes is how FDA have worked with corporations to really change the number of swabs that can be utilized. If you remember, just 4 weeks ago, we were recommending these nasopharyngeal swabs, and we've moved to multiple different swabs, multiple different extraction media. The intent is to continue to scale with the support of states and working with states to continue to scale testing. But at the same time, we have to realize that we have to have a breakthrough innovation in testing. We have to be able to detect antigen rather than constantly trying to detect the actual live virus or the viral particles itself, and to really move into antigen testing. And I know corporations and diagnostics are working on that now. We have to have a breakthrough. This RNA testing will carry us certainly through the spring and summer, but we need to have a huge technology breakthrough, and we're working on that at the same time.
So essentially what you're saying is you don't think we have the capacity to ramp up the testing you would like because we need this, we basically need a breakthrough for easier testing?
No, I think we have other technology that we think can come online within the next 2 to 3 weeks that will be a breakthrough in the RNA type testing. But I think also, just for ease of use, finding out how we can do antigen type testing like they do with flu. It can be used as a screening test, and then you can do the actual RNA testing for a confirmatory test. It just allows you to screen large numbers of individuals quickly.
The vice president on Friday said that by Memorial Day, in fact, I want to read the quote exactly here, that by Memorial Day, the epidemic, I think honestly, if you look at the trends today, that I think by Memorial Day weekend, we will largely have this coronavirus epidemic behind us. This Memorial Day 2020, is that realistic, that it's behind us? Can you explain what he means by that?
I think he means that in the models and in tracking our actual data, because previously we were using models based on data from around the world, and now we're very much tracking every single outbreak in the United States separately. And if you look at those outbreaks over time, and you look at places like Louisiana, if you look at Houston, if you look at Detroit, and you look at how they reach their peak and come down and what those cases look like as they come down, it gives us great hope when you project out Boston and Chicago and certainly the New York Metro, which we're all very still focused on. I mean, they still have 45% or so of the entire cases in the United States, and the majority, about 40 to 50% of the mortality. So we continue to watch this very closely, but that's where the projections take us. And it's very much based on Detroit, Louisiana, and other groups. And then looking at Seattle, that never really reached a peak and has never really had a large outbreak, and trying to understand what we can do as a people to ensure social distancing will be with us through the summer, to really ensure that we protect one another as we move through these phases.
Dr. Birx, help me understand what happened with the suggestion that the president made that the task force study disinfectant injections. You said he was digesting information at the time when that came out of his mouth. Do you have any more information, and are you concerned that people might take bleach because of what the president said?
I think I made it very clear and how I interpreted that. I also made it very clear, and so has Dr. Fauci and everyone associated with the task force, and their clarity around this is not a treatment. What was missed, and really I'm hoping the American people understand the reason why that study was important, that Department of Homeland Security did, was when we came and saw what MIT talked about as viral particles moving through the air. It's really important to figure out in the outside conditions, is there anything that decreases the half-life of that virus? And I think I was reassured personally to see what impact sunlight has on the virus and the viral half-life. That should be encouraging to all of us. We should still social distance. We should still wear those masks to protect others as we work through this epidemic. But I think it's really important to see that sunlight, direct sunlight, may actually be able to kill the virus.
Are you concerned the credibility of the scientists on the task force get undermined when the president, now with bleach, obviously you can't do that, and hydroxychloroquine, where the FDA had to put out a statement? I mean, is this undermining the credibility of you and Dr. Fauci and other scientists?
I think all of us are very clear in our discussions with the American people how we're looking and utilizing data to drive decision making within the task force. Every day about 2:30 in the morning, I get every single piece of data coming in from every county where we triangulate where's the virus moving, how are people responding to the virus, are we considering absolutely everything to protect American people, and triangulating that data to come up with that day's work. Where should PPE go? Where should we be really talking with governors about a recent outbreak? How do we protect individuals that are in essential services? This is the discussion of the task force, and the physicians and the individuals involved in the task force are every day focused on what's the most recent scientific evidence. And I think what really the American people should understand is in the guidelines that NIH recently published, really helpful, were put up this week to really talk about how to clinically approach this. But we've had really critical data that has come to the forefront over the last few days about how this virus is interacting with people in the United States. And I think that's really critical. We need to constantly be focusing on what we're learning to save more lives and to make our treatment more effective.
Dr. Birx, I have to leave it there. I appreciate you coming on and sharing the administration's view. Stay safe and healthy yourself.
Thank you.
Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe, and click over here to watch the latest interviews, highlights, and other digital exclusives.